I did my paper and presentation on epilepsy. The International Bureau for Epilepsy and the International League Against Epilepsy defines it as a brain disorder characterized by an enduring predisposition to generate epileptic seizures and by the neurobiological, cognitive, psychological, and social consequences of this condition. The prevalence is 0.5 to 1% of all children from birth to 16 years old, and 3 million Americans live with epilepsy each day. There are three main causes of epilepsy: structural or metabolic, and this is caused from brain injuries or diseases, and some examples are meningitis, brain damage, brain tumors, drugs or alcohol. Second is genetic, and this is from a genetic origin. And third is unknown, and this is causes that are unknown. Sorry about that window. And 60% of cases are unknown. There are two types of epilepsy / seizures. First is generalized, and this is where it affects the whole brain by changing electrical activity in the brain. And there are 5 types of generalized seizures. First is tonic, when the person becomes stiff and falls. Tonic-clonic, when the person is stiff, falls, and has repetitive jerking. Monoclonic, short jerky movements. Atonic, when a person drops to the ground. And absent, when a person stares blankly into space. Second is focal seizures, and this means that the seizure is affecting one part of the brain. And there's 4 main types of focal seizures. Temporal lobe, and this is when the person loses or has different feelings, thoughts, and emotions. Frontal lobe seizures. This is when the person experiences weakness in certain muscles. Occipital lobe seizures. This is when the person experiences visual phenomenon. And parietal lobe seizures. This is when a person experiences strange sensations. There are different epilepsy syndromes, and they can happen neonatal, infancy, childhood, adolescence, or adulthood. One that happens in infancy is West syndrome. One that happens in childhood is Landau-Kleffner syndrome. One that happens in adolescence or adulthood is juvenile monoclonic epilepsy, and I did put a little box down in the corner of different epilepsy syndromes and then the ages that they happen. The most common treatment for seizures are analeptic drugs, and there are over 20 analeptic drugs available. However, there are a lot of side effects that affect mood, behavior, memory, learning, attention, increase or decrease in appetite, drowsiness, double vision, dizziness, and a lot of people complain that sometimes the side effects can be almost as bad as the seizures themselves, so doctors have to watch and find that perfect drug that won't affect the person that much. Some other treatments. These treatments should be considered as last resort once all the analeptic drugs are tried and failed. The ketogenic diet is a controlled protein, high fat, low carbohydrate diet. Vagus nerve stimulation. This is where a device is placed over the collarbone which sends sporadic stimulation to the vagus nerve. And surgery. This is where removal of lesions, lobes, and one side of the brain, or disconnecting the area of the brain which sends seizures arises from. So there's different types of surgery that can be done. There is also epilepsy that happens in school. Right now there are 526 reported children with epilepsy in schools in the United States. 5% of those children are in special schools. 24.5 receive special education services while in regular education, and 67.7 are in private or public schools with a standard curriculum. And before we move on, I just want to say that a lot of teachers know the basics about epilepsy. They know what to do if someone has a seizure, but they don't realize a lot of the stuff that epilepsy causes, the learning problems, the behavior problems. So we're just going to go into that and touch upon that. First, epilepsy affects four domains. The first is physical, and the common problem you will see in physical is fatigue. The children want to sleep a lot more, take naps, and even not participate in some social and physical activities. And the side effects of physical side effects of antileptic drugs are weight gain, hair loss, clumsiness, headaches, increased appetite, visual disturbances, and dizziness. The emotional and behavior domain. The suicide and attempted suicide rates are much higher, and the emotional and behavioral side effects of antileptic drugs are increased sadness, anxiety, irritability, and mood changes. The social domain, there's a lot of embarrassment, feeling of not belonging, fitting in, and being different. There's a higher rate of bullying. And if you look down at my picture below, it says children with epilepsy are at a 42% greater chance of being bullied. And then also fear of telling people that they have epilepsy. And then you have the academic domain. Some things that they struggle with: their memory, math, attention, reading comprehension, spelling, reading, writing, expressive language. All schools should have an epilepsy policy, and it should include what occurs when a student with epilepsy joins the school, the administration of medicine, who is going to hand out that medicine, where are they going to take the medicine, tracking seizures. They can also track different if the behavior of the student has changed. So the doctor knows if medicine might not be working or it's affecting their behavior. What happens if a student has a seizure? Possible special education needs. A guideline if someone has a seizure. This is directly from an article that I read, and they took it directly from the NICE website. Do not move the child unless their current location may be dangerous. Near a sharp object, put something soft under the child's head to protect it from banging. Note the time the seizure started. Do not restrain the child's movement. Protect the airway. Loosen tight clothes around the neck. Wipe excessive saliva. Stay with the child until the seizure stops. Never put anything in the child's mouth. Let the seizure run its course. When jerking has stopped, roll the child on their side. Note the time the seizure stopped. And these are the references I used.